Hi, Dr. Lee is here from Claxton Hepburn. We're talking about lung cancer. Now, what is your position at Claxton Hepburn?
Good morning, Dave. Thank you for the invitation this morning. Thank you for all of you out there who've tuned in and joined us. My position is the Regional Medical Director for Pulmonary and Sleep Services at the Northstar Health Alliance that includes both the Claxton Hepburn campus and Carthage Area Hospital in both St. Lawrence County and Jefferson County.
Now, when it comes to lung cancer, I mean, the biggest thing that we've been talking about for years and years is smoking. Now you're a specialist when it comes to lungs. How damaging is smoking to your lungs?
Smoking is very damaging. It can be crippling by causing a disease called COPD emphysema. Nobody wants to end life badly in a wheelchair on oxygen. It is very damaging because it's the cause of primary lung cancer in over 95 to 98% of patients who develop it.
Now, what you have at Hepburn, you've got a lung screening. I mean, even the screening for lung cancer in the last 5, 10, 15, 20 years has come a long way. It's a lot less invasive as it used to be. What should you be looking for to get screened?
We use best practice criteria. This is national Medicare criteria. Anyone between the ages of 50 to 80 years of age, smoke a pack a day of cigarettes for 20 years or more, quit within the last 15 years, should approach their primary care provider and ask for low-dose screening. It's simple, it's cheap, you go in your street clothes, it's done in minutes. It's followed for at least 3 years by guidelines, and it helps us pick up early lung cancers. That could save your life.
Even the treatments, when it comes to finding a tumor, which that process is just amazing now that Hepburn has. Just the treatment has come a long way too.
Yes, it does, Dave, and that's a great point and a great question. If we pick up the tumor less than a third an inch in size, the 5-year survival rate is 92%. When it comes to between a third and 2/3 of an inch in size, the survival rate drops to 83%. After that, survival drops off the cliff. What we have at Claxton Hepburn is an integrated lung cancer screening program where we have a single reader radiologist that has an artificial intelligence co-pilot that helps him read these scans for you, the patient, and your providers in 3D. It does a multi-year comparison over thousands of images, provides a way we can pick up early cancers. We have a multidisciplinary clinic that we meet every month with in collaboration with thoracic surgery at upstate Syracuse. That way, with those specialists, as well as with our cancer center specialists, Dr. David Boyce and Dr. Daniel Kyung, we make consolidated, timely decisions for our patients. If we pick up an early cancer and they need treatment, early non-invasive robotic surgery is the quickest way to get rid of the tumor while preserving lung function and quality of life. Dr. Boyce also is able to provide stereotactic body radiation therapy, or SBRT, which is cruise missile radiation therapy, to destroy the tumor in place for those patients unfit for surgery, and still providing almost as good cure rates and survival rates.
Now, when it comes to treatment and the screening, obviously you should be a smoker or ex-smoker. What other signs should you be aware of that something may be wrong?
That's a great question, Dave. And many people ask me that question. What are the early signs of lung cancer? What are the early symptoms? The symptoms would be cough that doesn't go away after a few weeks, blood in the spit, hoarseness of voice, chest pain, shortness of breath that's where the cause is unclear. The truth of it is, by the time a patient with lung cancer presents with symptoms to his provider, 75%, 3/4 of the time, they have local disease, lung cancer that's already spread in the chest, or disease that's spread elsewhere to the bones, the brain, the liver, and elsewhere. So what we're trying to do is to pick up the patients before they're symptomatic. So the idea here is to create this awareness, which we're very grateful for you doing, for patients to take on the onus on themselves to go to their providers, give an honest history, and be open to a screen at either Claxton or Carthage.
So even before you're showing symptoms, smokers or ex-smokers, you should get screened.
That is the best time because once the patient has symptoms,
It's too late in most cases.
in 3/4 of the time,
Yeah.
we're not going to get 92 or 83% survival at 5 years. We are a beautiful community, Dave. And this is always going to be someone's mom, brother, or best friend.
Yeah. So if you're smoking, number one, quit. But if you were a smoker and you quit here in the last 15 years, before you're showing any symptoms, when it's too late, talk to your provider, get the screen taken care of. Do it before you show anything.
Absolutely. Absolutely. That'd
Okay.
be the key message.
Thank you for coming in today. We learned a lot.
Thank you so much, Dave. Thanks for having me. Thank you all for listening in.